1 out of 4 adults in the United States has non-alcoholic fatty liver disease. In this video, I will discuss what non-alcoholic fatty liver disease is, who is more likely to develop this condition, and how it is diagnosed and treated. Non-alcoholic fatty liver disease is defined by the accumulation of fat in liver cells, as shown by imaging or histologic study. It is not caused by alcohol, medications, infections, hereditary or autoimmune liver diseases. As mentioned earlier, non-alcoholic fatty liver disease affects 25% of adults in the United States. Non-alcoholic fatty liver disease has two subtypes, non-alcoholic fatty liver and non-alcoholic steatohepatitis or NASH. Non-alcoholic fatty liver is the mildest form of the disease. People with non-alcoholic fatty liver have extra fat in the liver, but there is no or little inflammation in the liver and there is no liver damage. Non-alcoholic fatty liver has a lower rate of disease progression than non-alcoholic steatohepatitis, and only about 4% of non-alcoholic fatty liver patients develop cirrhosis, which is a condition of scarring and inflammation in the liver with liver malfunction. In contrast, non-alcoholic steatohepatitis or NASH is a more severe form of the non-alcoholic fatty liver disease. People with NASH have inflammation and damage in the liver in addition to extra fat in the liver. More than 20% of patients with NASH develop cirrhosis in their lifetime. In addition, these patients are at increased risk of developing liver cancer. About 5% of adults in the United States have NASH. Although the exact cause of non-alcoholic fatty liver disease is still unclear, it is believed that insulin resistance or an impaired body response to insulin leads to an increased flow of free fatty acids into the liver. The free fatty acids are the building blocks of the fat in our bodies. Elevated insulin levels and insulin resistance also promote the production of triglycerides or fat in the liver. The combination of these two processes contributes to the development of fatty liver. Risk factors for non-alcoholic fatty liver disease are Hispanic or Asian population, postmenopausal women, obesity, especially when the fat is concentrated in the abdomen, high blood pressure, type 2 diabetes, high cholesterol, polycystic ovary syndrome, sleep apnea, low thyroid, etc. Patients with non-alcoholic fatty liver disease usually do not have any signs or symptoms. Occasionally, they may experience fatigue, weight pain, or discomfort in the abdomen. Many patients with NASH may not have any signs or symptoms either. With disease progression, patients with NASH, especially when they develop liver cirrhosis, can have signs and symptoms as shown in the pictures: ascites or abdominal swelling, spider-like blood vessels under the skin, jaundice, which is a yellowing of the skin and eyes, red palms, enlarged spleen. Other symptoms include extreme fatigue, weakness, weight loss, persistent itching, leg swelling, internal bleeding, muscle wasting, and confusion. Non-alcoholic fatty liver disease is usually identified incidentally in clinical practice. Diagnostic tests include blood tests, abdominal ultrasound, CT or MRI of the abdomen, transient elastography such as fibroscan, which measures the stiffness of the liver. Liver stiffness indicates fibrosis or scarring. Magnetic resonance elastography, which also measures liver stiffness. Liver biopsy, which is the gold standard for the diagnosis of NASH. Once diagnosed with non-alcoholic fatty liver disease, patients should focus on lifestyle changes such as healthy diet, exercise, and weight loss. These changes are the most effective treatment for non-alcoholic fatty liver disease. Low-calorie, low-fat diet helps reduce the amount of fat in the liver. For people who are overweight or obese, a 10% weight loss has been shown to reduce the amount of fat in the liver and reduce liver inflammation. Fructose consumption has been associated with NASH development and the progression of liver fibrosis or scarring in patients with non-alcoholic fatty liver disease. Avoid foods and drinks that are high in fructose, such as sugar-sweetened soda, honey, molasses, high fructose corn syrup, dried fruits, fruit juices, apples, grapes, etc. Foods low in fructose include blueberries, strawberries, carrots, avocados, green beans, and lettuce. Exercise reduces insulin resistance and decreases liver fat content independent of weight loss. The American Medical Association recommends over 150 minutes of exercise per week. Limit or abstain from alcohol consumption. For men, alcohol use should be limited to no more than 4 drinks on any day or 14 drinks per week. For women, alcohol use should be limited to no more than 3 drinks on any day or 7 drinks per week. In addition, avoid over-the-counter medications. People with non-alcoholic fatty liver disease should be vaccinated against hepatitis A and B if they are not immune. Although there is no FDA-approved medication for the treatment of non-alcoholic fatty liver disease, medications such as vitamin E and pioglitazone can be considered for biopsy-proven non-alcoholic steatohepatitis. Consult your physician whether these medications are appropriate for you. Bariatric surgery can be a treatment option for individuals who are obese and are unable to lose weight. In summary, non-alcoholic fatty liver disease is prevalent and affects 25% of adults in the United States. Non-alcoholic steatohepatitis, or NASH, is a more severe form of non-alcoholic fatty liver disease. About 5% of adults in the United States have NASH. 20% of the patients with NASH develop liver cirrhosis. Lifestyle changes such as healthy diet, exercise, and weight loss are the most effective treatment for non-alcoholic fatty liver disease.